Dallas really on edge this morning. A new chapter this morning in the battle against Ebola. You're looking live at the apartment of the first American infected with this deadly disease here at home.
And Robin, as you know, the nurse's apartment off limits right now. Hazmat teams clearing it out overnight. The whole neighborhood on alert. You heard that recording there. President Obama now calling for new measures to fight this disease. And we've got team coverage, of course, this morning. Dr. Besser is back with us. But we're going to begin with ABC's Tom Yamas outside the hospital in Dallas. Tom, good morning.
David, good morning to you. Hospital officials tell us that nurse was wearing a gown, gloves, a mask, and a shield while she was treating Thomas Eric Duncan, yet somehow she still got infected with Ebola. No one knows exactly why, but this morning everyone wants answers, including the president and her own neighbors who got this required reading. Ebola guidelines from the CDC dropped off on their doorsteps. This morning, this quaint Dallas community is on high alert after neighbors learned they're now living in a possible danger zone.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus.
That automated call followed by a swarm of hazmat teams working through the night to clear out, tape off, and decontaminate the apartment of that still unidentified nurse, the first person to contract Ebola inside the United States.
Definitely it's scary being in Dallas, but then when it's like right here.
The nurse had been caring for Thomas Eric Duncan before he died from the virus on Wednesday. She's now in isolation at that same Texas hospital after driving herself to the emergency room to report a low-grade fever on Friday.
That healthcare worker is a heroic person who provided care to Mr. Duncan.
While the hospital says it was careful to follow all CDC guidelines, they admit sometime during Duncan's 11-day stay, there was a mistake. President Obama now demanding the CDC investigate how the breach occurred, as health officials fear this nurse may not have been the only one.
Unfortunately, it is possible in the coming days that we will see additional cases of Ebola.
Right now, there are 48 people still under close watch who were exposed to Duncan before he was isolated. This nurse was not one of them, only coming into contact after he was hospitalized. Now she starts her own ring of possible exposure, extending so far to one person, believed to be a close friend or a boyfriend who came into contact with her once her symptoms became contagious. Her dog also being monitored as officials try to determine the transmission threat posed by animals. Now, the race is on to find anyone else who may have been infected. Officials are canvassing the neighborhood armed with police. And the fear of possible contagion spreading throughout the country. In Los Angeles, a United flight was quarantined on the runway after a passenger traveling from Africa complained of flu-like symptoms. Fortunately, it was a false alarm. And Ebola is taking its toll on this hospital in Dallas in several ways. Ambulances will no longer bring new patients here because of a staffing issue. This, as the CDC says, more cases are likely.